you know, I just happened to take this test today at Yale about this, so that's why it's on my mind. Like, just the Nafridil?
Actually, Nafridil tends to work better for like pure O's. I've seen Prozac tend to work better for OCs. That tends to be the way psychiatrists.
They didn't offer that, Prozac, instead of Nafridil.
Well, when you're in a drug study, they are more concerned with, you know, seeing this drug has this effect, and they just want it to be, you know, for the entire disorder. They don't want to hear that it only works for this particular problem. Yes?
With your diagram, are you saying that non-OCD people don't usually get spikes?
Oh no, I'm not an OCD, right. But I get spikes all the time.
Okay, but then in most cases they handle it in the NR part of your diagram. Is that what you're trying to say?
I would think so, or not in the ER response. They wouldn't do it to the same degree. And
but they would find it odd that they had that impulse of that thought.
Most people.
Like they just say, oh, you know, no big deal.
Well, yeah, I think most people, because I actually get a lot of my clients to survey their friends and say that, you know,
right.
if, you know, hey, do you ever get thoughts of like jumping off of bridges? And when they do, most people will say to them, yeah, I kind of get that thought, but, you know, I really don't think that much of it. I just think you know.
It doesn't become an obsession.
Right, and it doesn't. I think that the onset of OCD may be related to some period of a person's life where their level of distress surpasses their level of coping capacity, and that triggers a profound shift in the brain's processing. And for most of my clients, you can trace back the onset of the disorder to a very stressful period. It's usually adolescence or the beginning of college. But that's where it comes from. My shtick is, well, because I'm not an analyst, we're not going to spend so much time finding out where it came from. We're going to really focus in on how can you knock this off. Okay? Is there any questions? Yes.
How would you treat a patient came to you that had contamination fears and fears of germs? How would you treat a patient that was terrified of vomiting?
Terrified of vomiting?
Right.
That would, I'd do an intake to find out what mechanisms are you know, involved here. A person who is chronically obsessing about, oh my God, maybe I'm going to vomit, I might treat differently than someone who actually vomits and has a fearful response from that. But it would really depend on, I'd have to do like an intake to answer that very sufficiently. Yes?
This might sound like a basic kind of question, but...
I like those.
I don't understand, you were just saying that something could trigger you during your adolescence or during college. I mean, before that time, I was doing everything normal. As far as I know, everything, you know, my trouble is walking on lines. I can't step on cracks. I have to step over cracks and back and forth. And
see, that's not your problem. The problem is that when you step on a crack, or if you think that you might have, what would happen? Would someone die that you love?
That is going to happen.
Yes. Okay, that's the issue then.
And like you said, I don't get the feeling that I've I don't know, alleviated my feelings of anxiety by going back. I just feel a relaxed state that I know I can then continue to walk. But I don't understand why for years and years I've been walking and I look at people in malls that are walking up and down the malls and they're surviving, they're living, and yet I'm afraid to take another step because something bad's going to happen to me. Why? I don't understand. You know, if you're so intellectual and you can say to yourself, all these people are doing it, why can't I? Or I used to do it, and why can't I now?
Okay. I definitely was going to talk about that in as good a time as any. I have a profound belief that the part of the brain that's misfiring is in the lower regions. And what that says to me, if you know anything about brain anatomy, is that's a primitive part of the brain. That's where smell exists. That's where fear exists. That's where breathing exists. When we were single-cell amoebias, that lower part of the brain was still kind of functioning in sort of a weird way, but it still existed. And that's what's misfiring. What you were able to speak to me through is the neocortex, which is the higher part of the brain. And intellectually, that's why people will say to me, I know this is absurd, I know this is crazy, and that's because intellectually they know the stupidity of it, but the most basic part of your brain that says your organism is in jeopardy of dying is misfiring and sending you the signal that you're in that jeopardy, or someone that you love is in that jeopardy. Something awful will happen. And that's why you get such a profound sense of legitimacy to it. But I like looking at the brain as being multifaceted. It's not just this one little unit that's you. Your brain is made up of many different kind of yous. But there's a you that I can talk to that I say is the genuine you. And that part of your brain which misfires to me is not genuine to you. When I have a a spike to stab someone, to me that's not the genuine me. That's the spontaneous part of my brain. And so it's not going to benefit you to get worked up as to why is this happening to me, or am I going crazy, or I understand intellectually that this is nuts. Why can't I ever realize that though? And you won't. And why should you? But what you can do is you can delegitimize that base part of the brain by not attending to it. And along those ways, that's why the treatment called extinction comes into mind for me. And what extinction says is that if you stop reinforcing something, the behavior will drop out. And so...
So it's almost like it becomes a habit rather than a compulsion?
This isn't a habit. OCD is not a habit by any means. Biting your nails, pulling out your hair, those are habits. An analogy that I use that would have been in my article hadn't Jim told me it was too lengthy is the idea...
We're going to be here till midnight tonight. I just want to let you know.
Is it really running that long?
No.
No. Okay. Yeah, exactly. I went through that entire article. Let's say you have a 2-year-old child who throws a tantrum, and the mother decides that this is tantruming behavior over here. The mother decides that she doesn't know how to handle it anymore, and she goes to a behaviorist. And the behaviorist says to the mother, well, what you've got to do is stop giving your child the candy when he screams for it. You've got to stop buying the child a toy when he screams for it. You've got to stop reinforcing the tantrum behavior. And I look at that lowest part of our brain as being the culprit of throwing a tantrum. And it does throw a tantrum if you don't heed its call. So the psychologist says to the mother, well, stop feeding the child by giving into its demands. And what you're going to see initially is an incredible burst of tantrums, and then a gradual decrease. And so with this treatment of extinction for the pure obsessional thinker, when someone's getting better, their number of spikes skyrockets. And one reason for that is because they're going to ruminate a lot less. They're going to engage in the escape response a lot less. But also, just because humans, like rats, when you take away a reinforcer, the most basic system will say, something is amiss, how can I recreate familiarity? Because human organisms don't like being thrown off balance. They don't like new things. Yeah.
So is that like you have to retrain your brain all over again to think in a different way, to think?
You've got to stop legitimizing your whether it be the basal ganglia or the thalamus, you've got to stop legitimizing the tantrum. And when you do that over and over again, it sends back to the brain, you can scream all you want, you can tell me that the earth is going to end, that God's going to send me to hell and burn forever, I'm not giving in to you anymore. And with time, that reduces the spikes. It reduces the power that comes along with the spikes.
Just a quick question. With an operative medicine, once you go off of it, and you have results, have side effects as far as taking it and going off of it?
For the puros that I've worked with, and I think from what the research suggests, if you go on an afternoon without behavior therapy, going off of it, you're most likely to relapse.
Relapse? Oh, you have to, therapy won't work out.
Yeah, that's what the research suggests, and that's been my experiences
And you
also.
say therapy is a lot of